Indiana in the morning on a Tuesday. It's 12 minutes after 8 o'clock. Good morning to you, and thanks so much for being with us here today on this day. We're glad you're here. Glad also to welcome Carmen Buggey back into the studio with us. She was here a while ago in another capacity with IRMC, but she visits us today with her new capacity as a CRNP nurse, certified registered nurse practitioner. That's not an easy thing to say, Carmen.
It's not. It's easier just to say CRNP or NP.
There you go. Nurse practitioner in cardiology. And this is Heart Health Awareness Month. Our visit this morning is presented by Marcus and Mack, voted best law firm and best personal injury lawyer 3 years in a row in the Best of Indiana County contest. You can visit them online at marcusandmack.com. So when we had you here before, you were at the Plumville location.
I was.
The
Yeah,
clinic,
I worked out at the clinic in Plumville for about 5.5 years.
Uh-huh.
Yeah, so I was here, I think, shortly after I got hired with IPG the first time around.
Yeah, but now you're in the cardiology department.
I am.
What made you want to go there?
I've always had an interest in cardiology. So if I were to go into a specialty, this would have been my first choice. So I'm very fortunate that it's worked out this way. But I've always had an interest in cardiovascular health, and IPG really has a great group in the cardiology office. I've always thought so highly of Dr. McDowell and Melissa Duncan and Julia, and they've had some great additions in the past few years. So they just have such a great group over there, and I feel very fortunate to be a part of that now.
There are a lot of people that go through that practice. I mean, you've got a lot of people that use Indiana Cardiology or IRMC Cardiology.
Yeah, it's a pretty big group now.
Yeah.
Yeah.
And there's a reason for that. It's because, people want to be sure that they're getting the best heart health care that they can. And frankly, in our area with the demographics of our population, there are a lot of people who need to have our cardiology services.
Yes, definitely. Yeah.
So let's talk about that a little bit. When in their life should somebody who's not really experiencing any heart issues, when should they really begin to consider seeing a cardiologist on a regular basis? Is it event-driven or not?
So it's not so much based on your age, but it's more so based on your risk factors. So, if you have a healthy 65 or 70-year-old who has very little risk factor, so no family history, no diabetes, no hypertension, and they're not having any concerning symptoms, they likely would not need to see a cardiologist. But on the other hand, if you have a 40-year-old who maybe is diabetic or who has a significant family history of cardiovascular disease, then you would recommend that they see a cardiologist sooner. Yeah. So it's more so, it can be event driven, but it's also driven by risk factors.
Yeah. And for most people, would it be true that the very first sign that they need to see a cardiologist would be a visit to their family primary care facility?
I was going to say that primary care plays such an important role in referring to the specialties, not just cardiology, but all the specialties. So really you should have a visit at least once a year, just like a preventative health visit with your primary care doctor. At that visit, they should be checking your blood pressure, screening for cholesterol, depending on your age, obviously checking your weight and your BMI, and then based off of those things, they would make the decision to refer to cardiology.
Yeah, I think that's where a lot of people drop the ball.
That's an important piece of the puzzle. They're kind of on the front lines. Yeah. That's where I was before I moved into cardiology. So coming from primary care, it's very important.
So coming from that primary care background, when somebody would come in to see you at the clinic in Plumville or in some other setting, and you would give them that annual we always call it, I got to go for my physical. Or I come for my physical. Well, when they do come for that physical, what are the things that you are looking for as a primary care provider?
So again, that depends on your age. So there are certain age and your risk factors. So there are certain quality measures in primary care that you look for. So, women start mammograms at 40, that sort of thing. But from a cardiology standpoint, like I said, it's blood pressure, it's weight, it's cholesterol screening.
So those are the first things.
Yes.
And those are usually the first thing that happen as soon as you go into any doctor's office.
Typically, at least
Yeah.
the weight and the blood pressure. Yeah, the vital signs, definitely. Yeah.
They get right
That's
after
usually,
that.
no one is excited to step on the scale typically.
No, when I go, I demand that nobody say anything out loud, and I keep my eyes closed.
Yeah.
That's the way that I approach it. That kind of denial. But then you get recommended to go to see a cardiologist. And again,
In
this
some
is,
cases,
yeah,
yes.
this is for people who don't have an event that has caused them to go to the cardiologist. So they go. What happens when they walk in? For the very first time to see a cardiologist? Yeah, the very fact that you've been sent to a cardiologist can be intimidating for people.
Yeah, definitely. So, we would do the same thing at our office, get your vital signs. Most patients get an EKG. So a baseline EKG, and then we conduct a visit similar to how the primary care provider would conduct a visit, just through the lens of cardiology. So we'll go in and talk to the patient, gather their health history, so social history, family history, all of those things, and then just have an in-depth discussion about what symptoms they've been having or what risk factors they have, and then develop a plan with that patient as to how we're going to move forward, whether that's additional testing or trying to mitigate some of those risk factors. But it's, we conduct a visit similar to how primary care would, just through a bit of a different lens.
IRMC, of course, is having their cholesterol screening coming up on Thursday, and that event is sold out. Well, sold out isn't the way to put it. It's filled up. All the appointments are filled
that's
up.
Good.
For that.
Yeah, that's good.
That's a really, really good thing. But that's a screening that somebody concerned about heart health, I assume, would be interested in. What are the screenings that we should typically be pursuing?
So as far as routine screenings for cardiology, that's really, so it's weight, blood pressure, cholesterol. Some people, if they have a strong, they have a lot of risk factors or a strong family history, we would get an EKG on them at a certain time just to have a baseline. But there's really no recommendations for routine screening with like a stress test or an echocardiogram or anything like that, unless someone were having concerning symptoms.
All right, so we're talking this morning with Carmen Buggey, and we're talking about cardiac care. This is Heart Health Month, so we think about heart health and the ways that we can improve our odds of not having that event, that cardiac event. And there are plenty of them that we could be doing, and probably we could all be doing them a little bit better. So what are some of the things that we should be doing to protect our heart health right now?
So eating a healthy diet. Low in carbohydrates, low in saturated fats, regular exercise. Now that doesn't have to be anything, you don't have to be going to CrossFit 4 times a week, but even walking is great exercise. So regular exercise, healthy diet, good sleep. So sleeping well, trying to reduce stress in your life. All of those things can play a big role in your heart health.
We hear about foods that you should eat to protect your health and things to stay away from. You mentioned those trans fats. We need to stay away from those.
Yep.
But are there heart healthy foods that we should be maybe putting more of on our plate?
Yeah, so really a Mediterranean diet is a great diet for heart health. So lean meats, like lean protein sources like fish and turkey and chicken, as opposed to pork and beef and those red meats. And then keeping your sodium content low in your diet as well is great for heart health.
Blood pressure plays a big role in your hearts.
Yeah, and sodium plays a role in keeping your blood pressure down. So.
Yeah. And I think that what we tend to neglect is the fact that what we're drinking plays a big role in our heart health too.
Yeah, definitely. Yeah. And you can get a lot of extra calories through just what you're drinking and you don't even realize it. Also sodium. So Pedialyte has a ton of sodium, Gatorade, soda, all of those things have sodium with them. And a lot of times people don't realize that counts in your diet, not only what you're eating, but what you're drinking as well.
A lot of people would say, all right, Carmen, what you're telling me is if it tastes good, I shouldn't be having it.
Yeah, some people would argue that. Yeah. That's not always the case, though.
No, you have to be creative.
You have to get creative. Yeah, there are healthier options. You just have to find a way to, and a lot of times it's just based on convenience. People reach for the foods that are not as healthy for you just because they're more convenient. So, a lot of times at the beginning of the week, I will try to prep certain things that will be easy for me to grab throughout the week to help me kind of stick to a healthier diet.
When there has been an event, or even if there's not been an event, but you're on the way to having an event if you don't change a few things in your lifestyle. Follow-up care with IRMC Cardiology. People are going to have to continue to go when they've had a heart event.
Oh, yeah.
And so what are some of the things that we should be thinking about with those follow-ups? What are, when we go to that follow-up, they're going to be asking us a whole lot of questions about what we're doing in terms of our lifestyle.
Yeah, they're going to ask those lifestyle questions. They're going to ask about your exercise and your physical activity level. They're going to ask about your diet and probably how much sodium you're eating and that sort of thing. So it's going to be just kind of an in-depth conversation about how you've been feeling and what you've been doing and if you've made any changes. And then we kind of reassess where you are at that time. Yeah. So if recommendations were given, let's say 3 to 6 months ago, and you did implement some changes, or maybe we implemented some changes, started some medication or something like that, then we hope that you obviously are in better shape than you were when we saw you.
And when there's been a heart attack and that has been addressed and you're on your way back to health, I know that IRMC Cardiology has a great relationship with cardiac rehab at IRMC too, don't they?
Yeah, yes. Yeah, so cardiac rehab, they do exactly that. They rehab, but it's more specific to cardiology. They keep a closer eye on your heart health and the function of your heart while you're doing that therapy.
Yeah.
Just to make sure you don't overdo it and make sure that we're doing it in a safe way.
All an important part of the mix for your heart health here in this Heart Month. Carmen Buggey has been kind enough to join us today. Somebody wants to make an appointment with IRMC Cardiology. What should they do?
They should call IPG Cardiology, 724-463-9700.
I always put them on.
I just have it in my phone.
That's what we do.
Put it in your phone. If you think you might need it, put it in there.
That's what we do, isn't it?
I know. We're spoiled that way.
We don't know numbers anymore. We just
That's right.
click it up. It should automatically load in.
You could also call 724-357-7000. That's the main hospital number, and ask to be transferred to the cardiology office, and they'll get you in the right.
They'll take care of it.
Point you in the right direction.
Wonderful. Hey, good to see you again.
You too. Thank you so much for having me.
I'm glad that you came in to tell us. It is Cardiac Heart Health Month, but let's make sure that everybody is as healthy as we possibly can be. It's 8:25 in the morning. It's Indiana in the Morning on WCCS, 101.1 FM, AM 1160, WCCSradio.com. Boomer Sports